So good evening, everybody. Thank you for your patience as we waited for our whole team to get here. We appreciate that. I'm Councilman Yeager, Pete Yeager. I'm also the coordinator of the East Windsor Municipal Alliance for the Prevention of Substance Abuse. I practiced that a lot today, so I wouldn't get it wrong, because it is a bit of a mouthful. You may hear us refer to ourselves as the Alliance or as East Windsor MAPSA. But we are really happy that you're here. We are one of the sponsoring organizations, along with Prevention Coalition, Mercer County, and of course East Windsor Township. So you've got some good information already that hopefully you've received, and that's our brochure. Hopefully you're not sitting on it, but you can take a look at that. There's some information about who we are and what we do, but the most important thing in there is a list of resources and phone numbers that we've collected, and that may come in handy sometime down the road. So I'd encourage you to save that, not get rid of that, and keep it handy just in case you need those kinds of resources. The Alliance has been kind of pushing to have this meeting, and we are really excited that we were finally able to pull it together. The Alliance really works hard throughout the whole year, both on projects for the Alliance, and then also each member group does their own kind of thing to make sure that kids are staying away from these types of substances. So I want to acknowledge the Alliance. There are several members here in the audience today, and I'd like them to stand up and receive some applause for a lot of the good work that they do. Thank you. So tonight you're going to get a lot of good information about a very serious topic, and that is opioid abuse. This is a problem that is growing and impacts every community in the United States. The statistics are daunting when you start hearing them and thinking about them. Opioids were involved in about 33,000 deaths in 2015, and the rate of opioid overdoses have quadrupled since 1999. So you hear these kinds of statistics and you think, okay, well, it's overwhelming. What can we do about this? Is there hope? And there is hope. I think we're making some good progress. And one of the reasons why I think we're making really good progress are the people that we have up here at the table and people around the country that are working day and night to either prevent opioid abuse or to help with treatment. So I think there is hope. We are making progress, and I am encouraged by that. So tonight our panelists are going to provide, we've got kind of three mini panels. We're going to provide an overview of the situation, what the response has been, and then some information about treatment. So after that, we'll have a period of question and answer, so please keep track of those questions for later. Hopefully we'll get to everyone. I'm sure we will. And that's kind of how the evening will go. So to start off, we're going to start locally, as we should. And hear a little bit about what's happening here in East Windsor and how this community is addressing these problems. So I'd like to invite up Mayor Janice Mironov to start the program. Thanks. Thank you.
Okay, good evening. Sorry, I have multifaceted parts of my life these days, and this went a little longer than I expected, so I appreciate it. So first of all, I do want to also welcome all of you for being here. We appreciate it. We've had several sessions. We've had great participation, great turnout, and I do want to talk a little bit about some of the things that we have implemented here in East Windsor. First, I want to thank Councilman Peter Yeager, the coordinator of our East Windsor Municipal Alliance. He's done a great job in pulling this program together tonight and also throughout the year, and helping to coordinate our networking alliance and being able to support many initiatives in our community. I'm going to talk about a few of them in a moment. I also want to personally thank Barbara Sprechman from the Mercer Council and the Prevention Coalition for Mercer County, who's our partner in tonight's event. And we had some events along the way, but we prevailed, and we worked extremely well together. And I also want to note that she's also been a great source of support and resources during the course of the year on a number of the programs that we have been involved in here in East Windsor. So and I'm sure will continue to be. So thank you so much for being here tonight and all your good work along the way. I have other people I want to recognize as well, but I want to first move along and talk about some of the things that we have been doing here in East Windsor. Councilman Yeager, as indicated, is the coordinator of our Municipal Alliance, and I think there's probably some of the brochures out front underscoring some of the programs and activities that they are involved in throughout the year. I do sit on it, but I don't get to attend quite as much as I'd like. Councilman Zoller also has become an active member of the Alliance, and appreciate that as well. So some of the programs that are supported through our Municipal Alliance include the After Prom event that is yearly held, that has had an outstanding track record in providing a safe environment for our young people on their prom night. Also our DARE program, which brings good lessons and good values through our police department into our fifth grades throughout the school district. We also support a number of initiatives through Better Beginnings and through RISE and other organizations that are able to come into our community, into our schools, and help support and assist young people in mentoring them, giving them the kind of support that is so important in ensuring that we have well-balanced, healthy young people in our community. So there are a number of different places we've been able to reach out. We also, in East Windsor, we sponsor a program, we Check 421, which is a partnership between the business community and the elected officials and community leaders to deter young people from underage drinking. We're here to talk more about opioid abuse, but alcohol abuse is part of that and remains a very serious problem in our communities. The statistics are staggering as well. So this is one of our outreaches and proactive activities to bring those different communities together. One of the things that we've also implemented in the last year or so is a permanent drop box for medication. That's available 24/7 in the lobby of our police court building on 1 Mile Road. It is a way to encourage people to dispose of unneeded, expired prescriptions and medications in a safe and secure and environmentally responsible manner, and obviously to keep them out of the hands of people who should not have access to those kinds of medications. So we hope and encourage people to utilize that. More recently, through our police department, we have implemented in East Windsor CARE, Community Addiction Recovery Effort, and I want to thank and commend our police chief and frankly our officers who this is the kind of thing that they really enjoy doing. They obviously are law enforcement officers, but they're caring, and many times the means of best doing law enforcement is to give people alternatives so that they can address the issues that are affecting their lives and maybe are creating activities and behaviors that are not so good. And this is an opportunity where officers are encouraged to refer people that they encounter, whether it's through an arrest or an incident or somebody stops by. We've established a partnership with recovery advocates that we are able to counsel them, refer them to resources, and try to get them into a permanent regular program to address abuse issues and related concerns that create those problems. So those are some of the initiatives. We are very proud in East Windsor that we've been very proactive in recognizing and finding ways to reach out, to identify resources and to work with people in our community who have a need. Tonight, actually, what I want to spend most of the rest of my time on, I have to say I'm really excited, and I actually have it in writing now. So many of you have been involved in ongoing efforts to jumpstart out in our community some new opportunities for individuals who are at risk and their families. And so I'm really excited to announce tonight a brand new initiative here in East Windsor, which is a Mercer County supported substance abuse initiative commencing Tuesday, October 3rd. There will be new professional services available, substance abuse and mental health support for individuals and families. The services will be provided by Family Guidance Center and be available to residents in East Windsor and Hightstown. Obviously, we have a shared school district and many shared community organizations and efforts. The services will be offered at the Western Monmouth County YMCA facility located at 230 Mercer Street, which is on Route 33. The agency's clinician will be available initially on Tuesdays, 2 p.m. to 7 p.m., and Thursdays, 2 p.m. to 6 p.m. by appointment, and the appointment can be scheduled by calling 609-731-2461. When I am finished, I will put these out and distribute them. And the new initiative, the new anti-substance abuse initiative, will provide professional clinical services based right here in our community. It's a very exciting, a highly needed step forward in making local options available to assist individuals at risk here in our community. As so many individuals and families are and will be impacted by opiate abuse and addiction, it's important to offer this kind of professional support and resources and efforts to effectively address these mental health and substance abuse issues and situations. I do want to indicate that we are extremely grateful to the Mercer County Department of Human Services for their ongoing advocacy and support in identifying startup funding and the needed steps to launch this important proactive initiative. My thanks also to the Western Monmouth YMCA and their CEO, my friend Cynthia Joy, for enthusiastically stepping forward as a partner in housing this project. And very, very importantly, I want to recognize and applaud the many concerned local citizens and parents who have made their voices heard and joined together with us at several meetings and other gatherings to push for implementation of for these vital professional services and other support opportunities in the community. And I want to urge them to remain proactive because we have a great deal of work ahead of us to make these new service efforts widely known and successfully utilized, and thereafter build on these initial steps to further expand opportunities to serve the needs of our community. So this is a new announcement if you didn't get that. So many people worked very hard to get to this point, and it's a start, and it's a very exciting new opportunity here in East Windsor. I do want to just note, additionally, a regular program entitled Parenting Wisely, with the assistance of the Mercer Council on Alcoholism and Drug Addiction, will be offered with weekly sessions starting in the evening on Wednesday, October 4. And these sessions are geared to increase parental communications and coping mechanisms for those with children who are at risk or exhibiting behavioral problems. And there's a place to sign up for those who want to take advantage. And lastly, I just want to note as well that on Wednesday, October 11th, from 5 p.m. to 7 p.m., there will be an open house, be hosted by Family Guidance Center at the new offices at the Western Monmouth County YMCA building. This will be an opportunity for local citizens and families to come out and meet the staff, tour the facilities, and obtain information, further information and answers to questions that they may have concerning these new local initiatives and programs. So strongly urge people, of course, to stop by, to let other people know, to spread the word, and give people an opportunity to become aware of these new opportunities in our community. So I know that Mary Grace and Ann Daraki are here, and I'd like them to please come up. for a moment. They don't even have to, just want to come up and be recognized. Did I say anything wrong?
No.
Okay, they're my affirmation. That's really what they've been very helpful along with others, and I do want to thank them personally. And who am I missing? Any missing?
No.
Okay, I don't want to miss anybody. That's not good. So thank you so much, and we will be continuing to work together because this is a start. As I indicated, there's work to be done, and we need to build on this initial launch. With that, I'm going to hand it back because I've taken enough time and I was late. I'm sorry. We have a great program, and it will, I think, give everyone a sense of really the dedicated people that we have in Mercer County and some of the programs, and hopefully provide some good information and answers to many of your concerns and questions. I will make those flyers available so that please, I'm going to leave them before you leave. Everyone, please take one. And thank you.
Thank you. Thank you, Mayor. So our first panel is going to deal with a public health perspective and a law enforcement perspective about the opioid abuse epidemic. So we're pleased to welcome Tammy Lee from Robert Wood Johnson University Hospital and Mercer County Prosecutor Angelo Onofri of East Windsor. Welcome, everyone. Tammy's been a nurse at Robert Wood Johnson University Hospital since 1986. She served as a floor nurse, then was an emergency room nurse, helped start a medical clinic at the hospital, and then was the clinic manager. She eventually moved back to the emergency department, and then in June 2015, Tammy was elevated to the role of manager of the emergency department. And just recently, congratulations, she's been promoted to Assistant Director of Emergency Services, Adults and Pediatrics. Tammy is an active participant in TOPAC, the Overdose Prevention Agency Corporation, and is a member of the Mercer County Coalition on Drug and Alcohol Coalition. So we'll start with Tammy, and then I'll introduce Angelo. You're welcome.
Thank you very much for inviting me. I'm just going to start with I always like to start with some stats and talk about the opiate epidemic. I like to refer to it as an opiate crisis. It's a rapid increase of use of prescription meds and also that non-prescription opiate drugs that we use in the United States. The opiates are a diverse class of this very strong painkillers, which you're all aware of. But I think what we need to really address is that they're not only used for pain, they're used for recreational usage. And that's what has changed for me in the years that I've been a nurse, is that I used to see they're prescribed for back surgeries, knees, but now it's grown to be much more than that. And I'd just like to read some statistics that I think are very, they kind of bring it home. According to the U.S. Drug Enforcement Administration, overdose deaths, particularly from prescription drugs and heroin, have reached epidemic. We are aware of that, I think. Drug overdoses have since become the leading cause of death for Americans under 50. And then 2/3 of the deaths are from opiates. By 2015, annual overdose death surpassed deaths from both car accidents and guns. In 2016, 62,000 Americans have died from overdoses, 19% more than 2015. And then this is really stunning. This is more Americans have died in 1 year from opiates than from being in war in 1 year, 62,000 people. When the death rate varies from each of our states, it does vary, but public health experts estimate nationwide 500,000 people could die from an epidemic over the next 5 to 10 years. And this is why it's become a passion for Robert Wood Johnson, and even our legacy hospitals, RWJ Barnabas. We now have 11 hospitals within the state of New Jersey. But also this really has become such a, when you see it in the emergency room, it's a couple patients in a year. Now it's become many more than just a couple. And it's not the faces that we used to see. We used to think, oh, it's the street guys, it's the people that used to be in the street, it's our neighbors. It's our sons, it's our daughters, or it's our husbands. It's a whole different group. It doesn't miss any particular ethnicity or group of people. In November 2014, the prosecutor's officers, a law was passed where drugs, Narcan could be given for reversals. And we also partnered with the Mercer County Drug and Alcohol Coalition, and also we partnered with TOPAC, the Overdose Protection Agency. And we really started to look at these groups and really wanted to seek out for help. We actually and give out these start packets to our patients and their families, and it kind of started, on a slower track, but just recently in the last year or so, we really have picked up using this, and I'll talk a little bit about the ORP program. But in Robert Wood, in our ER, now we have passed where the opiate law C-28 and efforts in March 2017, our ED collaborators and our emergency room physicians have signed an agreement that they will not exceed 5 days of opiate prescriptions. And that doesn't mean that we won't reassess, and if the patient needs to have that opiate, we would prescribe that, but we're not going to prescribe 2 weeks, 3 weeks, and the patient become addicted. All our ER physicians are enrolled in the PDMP, which is our prescription drug monitoring program. And these reports are actually given to us on a quarterly basis. And we look at them right now every 2 weeks just to be assured that our physicians are not overprescribing and they're prescribing correctly. And these efforts really resulted in a 7.1 decrease in the percentage of ED patients discharged with opiate prescriptions. In the first quarter, we were 9.38, and now we've begun to 7.1% decrease. And then in this year, March 2017, we actually signed a grant with Barb's Mercer County Alcohol and Drug Coalition, the OORP program. And this is the opioid overdose recovery program, which seeks those individuals that have been reversed by Narcan and get them the help they needed. It actually works as we called Jocelyn, one of the navigators that we call her, and then they disperse a recovery specialist, which would be John or the recovery advocate team, and they actually respond. It's unbelievable. 10 to 15 minutes they're there at the hospital, at the bedside, speaking to the patient, and this is really where it starts. Currently, we've had 42 calls to John and the recovery advocates. We've placed 13 patients in detox, 6 in treatment, 10 patients have refused, and 8 of them with no service. But 5 patients were given recovery support, which this is important as well. When the patient is there, they actually, if they decide they don't want to participate in maybe detox or recovery, they actually have a person they can reach out to later. Maybe they're not sure right now what they want to do, but maybe they can reach out to John later or even contact us. In Mercer County, more than 46 people died at accidental overdose. 26 overdoses resulted in heroin and 9 deaths from fentanyl. Narcan has been deployed in reversals of opiate overdoses 263 times and reversals 233 and deaths 14. I think my goal is always to say increase awareness. RWJ contributes to the decline in the opiate overdoses and be the missing link that we need to have to connect these individuals to help, and continue to educate our staff, our parents, and be advocates and make sure that you're well aware of what's going on. Thank you very much.
I'm pleased to introduce Angelo now. Angelo was sworn in as Mercer County Prosecutor in December of 2016 after serving as acting prosecutor since March of 2015. And as the county's chief law enforcement officer, he leads the 200-member prosecutor's office. During his time as first assistant and acting prosecutor, Mr. Onofri was instrumental in the expansion of the Mercer County Narcotics Task Force. And more recently, he's played a vital role in our fight against prescription drug and heroin abuse through the implementation of Narcan and One Voice programs in Mercer County. He's collaborating with law enforcement, the healthcare, and other community organizations to provide first responders with the overdose antidote, make treatment and resources available, and host community forums and participate in community forums like this. So we're pleased that he can join us, and thanks for coming. No, sure, go right ahead.
Good evening, everyone. Before I begin, I just want to introduce 2 people that are very important to the mission of my office, and that's freeholder John Cimino and freeholder Andy Kuntz. Thanks for being here again this evening. There's a few critical concepts to understand as we're here this evening. The first is that heroin and opioids are everywhere. They're in every town in New Jersey. People of every race, color, creed, and age, as well as socioeconomic status, can be and are addicted. The second is that there shouldn't be a stigma attached to saying that you, a loved one, or a family member has an addiction problem. It's okay to ask for help. Governor Christie, the Attorney General, the New Jersey Legislature, Mayors such as Mayor Mironoff and Mayor Kelly and Mayor Kelly and Mayor Dave Freed, who are all in this area, are all speaking out about opioid abuse and awareness. All 21 county prosecutors, everyone is talking about addiction, recovery, and treatment. And the final thing to remember is that, frankly, we will never arrest or prosecute our way out of this addiction problem. That's why programs that have been implemented in here, such as the mayor mentioned, DARE, the LEAD program, Operation Dropbox, where the prescription drugs can be dropped off, as well as the CARE program, are instrumental to make sure that we break that cycle of addiction so that people don't turn to breaking the law. It's incredibly important. And Mayor, thank you for your leadership and all that. As Tammy said, heroin use has reached a 21-year high, and it's been called alarming by the United Nations report on world drugs and crime. The National Institute of Health estimates that there are over 1 million active heroin users in the United States, and that every day there are 78 new heroin users in this country. A recent article on NewJersey.com was entitled Heroin Town. And Heroin Town sought to bring to reality the scope of the heroin epidemic in New Jersey. Heroin Town is comprised of 128,000 residents, making it the 4th largest municipality in the state of New Jersey. So who lives in Heroin Town? The residents from all walks of life. They're between ages 17 and 79, with the youngest resident of Heroin Town being 13 years old. They're soccer moms. They're athletes, doctors, lawyers, teachers. Anyone can be a resident of Heroin Town. The majority of the population is between 18 and 26 years old, and it has been declared as a national health epidemic, as you can see by those numbers. In 2016 alone in New Jersey, it was estimated that there were between 22,090 and 2,250 deaths. Those numbers mean, very simply, that heroin was responsible for the death of the populations of more than 60 New Jersey towns. And all this is with most police departments in New Jersey employing the Narcan program. As Tammy mentioned, I have to correct the number, I just got the one as of about an hour ago. There's been 273 reversals here in Mercer County. So why have we had this increase in heroin? Well, first you need to understand what starts everything. And what starts everything is prescription medications. Prescriptions are legal, but then people get addicted to them. That's part of the reason why Attorney General Chris Perino signed his directive indicating that doctors could only prescribe 5 days of opioids, as opposed to the 30 days that were commonly prescribed before. Here in Mercer County, we have the highest heroin purity level in the United States at 65%. Because of the heroin purity level, heroin's become chic now. No longer do you have that image, as Tammy mentioned, of the street person with a needle in their arm. Heroin's now being snorted the way that cocaine was during the 80s. And because of those purity levels that we're experiencing, that's the reason we're experiencing so many overdoses, even among first-time users. In addition to being extremely pure, heroin is extremely cheap. It's selling in the city of Trenton for between $2 and $6 a deck. And a deck of heroin is the rough equivalent of a Splenda packet. In 2016, we saw 55 heroin-related deaths. And if you don't think that heroin's all around us, let me just tell you what my office has done, just my office, in terms of taking heroin off the streets. In 2016, we seized 13,213 decks of heroin and an additional 9.3 pounds of raw heroin. This year, because of a major bust that occurred, and this is to date, we have seized 14 kilograms plus 60 grams of raw heroin here in Mercer County, which is approximately 30 pounds. Heroin is all over. It's incredibly addictive. And knock on wood, we haven't experienced what Monmouth and Ocean counties are experiencing in terms of heroin hotshots. And a hotshot is heroin laced with a drug called fentanyl, which is 50 times stronger than heroin in its raw form. On top of that, Monmouth and Ocean have also started to experience a new drug called carfentanil, which is 10,000 times stronger than morphine. So in addition to it's an elephant tranquilizer. That's what it's being laced with. And because the heroin is so addictive, and because it's so plentiful, a lot of these first-time users are experiencing overdose and overdose deaths. As I said, everything with heroin begins with pills, and it's when that prescription runs out, that's when people turn to heroin. A pill of OxyContin on the streets is selling for about $20 a pill. Compare that to between $2 and $6 per deck of heroin. It doesn't take a lot to think what the people are going to go to turn to once that prescription runs out. The American Society of Addiction Medicine said that 4 out of 5 heroin addicts started with legally prescribed opioids such as OxyContin, Percocet, and Vicodin. One of the other things I just wanted to talk about very briefly were a lot of the programs that are going on, and they were mentioned both by the mayor and by Tammy. The issue is, please don't think that law enforcement or anyone's trying to be soft on this issue. But we've seen over and over again, the minute that you arrest a heroin addict, let them back out on the street, one of two things are going to happen. They're going to overdose, or they're going to commit a new crime. That's why we have to break that cycle. And it wasn't an easy thing for the mayor and Chief Geary to try to bring care here to East Windsor. It's something that not a lot of people have that kind of courage to do, and I do applaud you for that, Mayor. So finally, I'd like to leave you with this. We've done a lot of initiatives in Hamilton Township, and we're hoping to bring this, and the reason we started in Hamilton was that if we can make it work in Hamilton with 4 high schools, we can pretty much make it work anywhere. But we've brought the Hamilton Initiative, which is a week-long program in the spring and in the fall, where we talk about the Overdose Prevention Act, where we talk about the opioid epidemic, where we talk about Narcan, where we talk about don't run, call 911, which is really the theme of the Overdose Prevention Act. As Tammy mentioned, we have the START packets. The drop boxes are in every police department in Mercer County, including the colleges. On top of that, this coming October, there'll be the Take Back initiative by the Drug Enforcement Administration, where drop boxes will again be placed at the police departments. You can bring used, unwanted, or expired medications there and drop them off, no questions asked. And the one other thing, and there was an article today on New Jersey 1015 on their website. And what was interesting about it was that it was saying that Narcan, while it's been tremendous in saving lives, has really become somewhat of an invitation for people to experiment with heroin. And here, because of we're a transportation hub here in Mercer County, with the train station and all the different towns, the word has gotten out that every police department in Mercer County has Narcan. So we have people coming from out of county and out of town and even out of state doing the heroin here, overdosing, and then getting the Narcan, all because Mercer County has that. And just to go back for 1 second for the Attorney General's directive, you may say, well, how does that really help us? You're getting a 5-day supply that can be renewed rather than 30 days that we used to get before. The answer is very simple. The Attorney General, when he did that, noticed that there was a lot of prescription fraud going on. A lot of people were turning that 30 into a 90 or an 80. Unfortunately, we had worked with all the pharmacies and they were aware how to tell that a prescription blank had been forged. And here in Mercer County, we were the 12th ranked county in terms of opioid prescription among doctors. Legal prescriptions, we were 12th in all of New Jersey, and that added to the epidemic. So again, having events like this, coming out in public, having it recorded, having the newspapers here to cover it, having the mayor speak at it, to have your councilman and your assemblyman involved with this, and Senator Greenstein, who was here before, Councilman Kurz, even from a different town, and our freeholders, getting out in the open, talking about it, and removing the stigma, it is what is going to help us tackle this heroin and opioid epidemic. Thanks, everybody. I appreciate you coming out tonight.
Thank you, Angelo. So our next two speakers are going to talk about the epidemic from a response perspective. How are we responding to that? So we have Assemblyman Dan Benson, who will be speaking first, and then Barbara Sprechman, who will speak after him. So Assemblyman Benson represents the 14th Legislative District in the New Jersey State General Assembly, which includes East Windsor, and has served as an Assemblyman since 2011. And prior to that, Dan also served as Mercer County freeholder and a Hamilton Township council member. He's chair of the Law and Public Safety Committee, also serves on the Health and Senior Services Committee and the Transportation Committee. Dan has sponsored legislation requiring health insurance coverage for treatment of substance abuse disorders, and he's been very active in working to reduce the impact of opioid abuse here in Mercer County. And he's a good friend and a frequent visitor to East Windsor. So Dan, thanks for participating.
Thank you so much. Can everybody hear me? Okay, good. First, I want to thank the mayor, and I'd like to thank the Municipal Alliance, Pete, and all the local officials and county officials that are here. It's really a partnership, and that's what it's going to take. It's going to take everybody. And so our legislative responses, as is most the case when it comes to legislation, is a game of catch-up. We passed the first kind of landmark piece of legislation dealing with this crisis in 2013. It was signed by the governor. That was the overdose, opioid overdose antidote and prevention act. That was signed by the governor in May of 2013. So we're just coming up, and it went into effect in December. So we're coming up on about 4 years of that being into effect. It's actually two pieces of legislation. I was the sponsor of what we all know as the Narcan bill, to make sure for the first time in New Jersey's history, prescriptions were not being written to the individual, but it allowed us to have a prescription written out to allow first responders to carry it, as well as family members and those in recovery or those in addiction as well to carry those, other community activists to be trained on how to use this. The other half is that dial 911 don't leave. You see a lot of different slogans for that. It's on the back of your here. Don't run, dial 911. This is really important. If you dial 911, you will not be prosecuted. This is so important, particularly for our college students and for young people that may not know about this, but even of all ages. That came about, those two bills, was actually really difficult to pass, to show you how far we've come in those 4 years. In fact, initially, the dial 911 don't run was vetoed, absolute vetoed by the governor at the time. And think about it now, Governor Christie today was with Kellyanne Connolly talking about their latest initiative to attack this crisis. So we've come so far in terms of stigma and kind of moral questions about drug abuse and understanding that it's a disease that we have to attack from every angle legislatively. I bring that up because now with those two pieces together, we were able to tackle something so important. But think about it. We're now able to try to revive someone when they're at death's door. It's a real easy moral argument when somebody's about to die to say, should they live or not? And if you have a way to make them live, Narcan, shouldn't we do everything possible to save that life? That really cut through a lot of the moral arguments in the legislature, and we were able to pass that. We knew it wasn't going to save everybody. In fact, because of the strength and because of the long-lasting effect of the opiates that are on the street these days, some take multiple doses of Narcan to be revived and be able to make it to a hospital. In some cases, it's not even enough. But the reason why I bring that up is, so 4 years ago, we were able to take action because we felt at the very end of a person's life, it was worth saving. So the argument I've been making for the last 4 years in trying to get legislation passed, working with my colleagues here in the 14th District, I know Senator Greenstein was here earlier, but also with Senator Vitale, who's my partner on these issues, and he's really been the leader in the state legislature, both in the Senate and the Assembly, on so much of our legislation. Really has the ear of the governor in trying to push the kind of the envelope. I'm going to talk about some of those initiatives. But if we're able to do that at the end of life, why shouldn't we be able to do this early on when we have a chance to keep them from either getting addicted in the first place or getting further into the throes of addiction and try to save them before they get to death's door? So I'm just going to talk about some of the legislation we passed in those 4 years. You've heard about the prescription monitoring program that's being used in the emergency rooms. Actually, it has access by all doctors. It's actually something that's permissive. It's not mandatory yet right now. There are proposals to make it mandatory. There's some positives and negatives to that. It doesn't necessarily always cross state boundaries, and so there's talks about how do we make sure that that information gets shared in a real-time manner so that we're not seeing someone prescription shop from emergency room to emergency room or from other doctors. And then more recently, the 5-day supply, thanks to our Attorney General. And again, there is not only to prevent abuse, but for someone who actually does need an opioid, but just may not need it more than 5 days. We want to make sure that that drug is not in somebody's medicine cabinet for the person that it was prescribed to take it recreationally, or to have someone in their family find it and either take it themselves or sell it or give it away to another person. We've tried to expand where we found barriers for Narcan to being released. So first responders could have it, but it's still a prescription. It still requires a doctor to write a prescription out. What we were finding was not a lot of doctors wanted to write that prescription. So thankfully, our largest chain pharmacies stepped up to the plate. They had in-house doctors or doctors they had contracts with who were willing to write what's called a standing order, which allowed those pharmacies to give out Narcan for folks without a prescription. The problem with that was then, if you're an independent pharmacy, you may not have had that type of relationship. So we just passed and was signed into law this past year. Now that an official with the State Department of Health, who's the medical officer, now will write on demand any pharmacy that standing order, so that every pharmacy in the state of New Jersey now, if they so choose, can give that out without a prescription. So that continues to improve the coverage of Narcan. Not only that 5-day supply is important, but we've worked very closely with medical associations, particularly the Dental Association. For years, the Dental Association, dentists would give Percocets, a 30-day supply. So we worked both with the Dental Association and insurers, because for a long time, we were finding out that insurers, when presented with a less than 30-day supply, were saying, no, we don't want them to have to come back and then we'll pay twice. We just want to pay once. And so they were encouraging doctors to write a 30-day script. That's all changed now. In fact, in most cases, the Dental Association has phased out the writing of opioids, except in certain types of surgeries. But for the most part now, they have changed because of new guidance that has shown that the response is the same if you give them Advil and other types of analgesics and other pain medications. We want to make sure doctors, when they're prescribing these drugs, have that conversation with their patients. And so we passed a law this past year that requires prescribers to discuss addiction risks associated with certain drugs prior to giving that prescription, that first 5-day prescription. You've heard about the CARE program. I'm just so grateful that I know East Windsor has been leading on that, along with other towns in Mercer County, that allows law enforcement, once pick someone up in a nonviolent offense for first-time drug, can actually try to get them into a program before their court case. We passed the law again on that last year in October, that it establishes law enforcement assisted addiction recovery referral programs like CARE, so that it encourages all across the state to see those programs that were spearheaded here in Mercer County be replicated. Finally, I just want to talk about some of the things of where do we go from here. The governor today announced the $200 million initiative to really focus on some of the gaps. If you have Medicaid, you have access to potentially to treatment if a bed's available. One of the big issues now is making sure we have enough facilities in the state. That continues to be an issue. Secondly, if you have private insurance as well, it really varies what that covers. So part of this initiative, $200 million initiative that was announced, would try to cover those folks in the gap that aren't Medicaid and don't have private insurance and aren't Medicaid eligible. But that's something we in the legislature are looking at very closely. And then lastly, looking at programs particularly for our youth. We want to make sure every school adopts what's called an SBIRT program, where you have screening, brief intervention, and referral for treatment. It's worked extremely well in other states. We've seen some schools adopt that model. We want to make sure every school system has that type of peer-reviewed, clinically proven model where we're screening students based on referrals and things to make sure that they're getting help early on. Because we see, again, that problem so much. Oftentimes when we lose our students in their early 20s, it's because it started when they were in high school. Just the last two things, I know I've been talking for a long time, and I apologize. There's just so much going on. Two things coming up down the pike that we have to really be careful looking at. One is happening in September. Right now, there's a debate in Congress on health care. You've seen the debate about trying to repeal Obamacare. One piece of that in the current bill is called the Graham-Cassidy bill. You'll be reading a lot about that in the papers. It also phases out Medicaid as we know it over the next so many years. That could have a huge impact, since a majority of the folks that are receiving services, insurance coverage services, are through Medicaid. And then the last one is, we will probably see, regardless of who the new governor is next time, legislation about decriminalization of marijuana or legalization of marijuana. There's some positive benefits to those legislation, but no matter what, that does have an impact on the conversations that we're having here. So it's something that, for another forum, another thing to talk about, but as we make these decisions, we need to watch those carefully. We need to watch what's going on in other states and seeing what impact that has on drug use and drug abuse and addiction. So we have a lot of work to do in the legislature. We, again, I just want to thank our partners in local government, in law enforcement, in our health fields, but particularly those like Barbara that are really at the forefront of saving lives, and our community partners as well. Thank you so much.
So our next speaker is Barbara Sprechman, and Barbara is the Assistant Executive Director at the Mercer Council. Barbara has 25 years experience in the field of prevention as a program administrator, a trainer, a grant writer. She's a certified prevention specialist, and for the past 6 years, she's coordinated the Prevention Coalition of Mercer County. See, you should have waited a second, then it could have, it's a group of over 60 members, and they are working on the front lines to try and address this problem. She started at Mercer Council in 2010, and I just want to say thank you to Barbara, because when we were pulling this meeting together, Barbara was instrumental making sure our speakers were lined up and getting this off the ground. So Barbara, thank you very much for helping out with that.
Thank you for having me and for putting this on tonight, because it really is so important. As Pete mentioned, I head up the Prevention Coalition of Mercer County. We've been around for 6 years, and we're a group of very concerned citizens and residents in Mercer County just looking to reduce substance abuse and misuse in the county. One of our, of course, high priority areas is prescription drug misuse, which has led to the opiates epidemic and heroin and so forth. And initially, when we started 6 years ago and we did a needs assessment in our communities, we found that many youth were misusing prescription drugs because of several reasons. First of all, there was a low perception of risk. Young people thought, well, if they're legal, they must not be bad for you. I mean, how bad could they really be? And so they were busy using their sharing unused drugs, either to get high or for academic advantage. And also because of the availability and the access of these drugs, many youth were getting them out of medicine cabinets of their friends, of their family, of their grandparents, and experimenting with them there because they were so easy to get. We used to say, lock up your liquor cabinet, but now we also say lock up your medicine cabinet. It's very important to make sure that these drugs are secured. So we worked on strategies that would produce community-level change around prescription drug misuse that would impact many areas within the community where the environments were conducive to drug use. So we were trying to work on modifying and changing policies in schools and government, in households, providing information and supporting and enhancing skill development. And so over the past 6 years, we've been really pleased to be partnering with very important community partners such as our prosecutor in initiatives such as International Overdose Awareness Day, the START initiative, which Angelo had mentioned, with the distribution of resource packets to law enforcement and hospitals and EMTs to provide the local treatment information. We've also done realtor information sessions where we go in and we talk to realtors about making sure that their clients lock up their medications when they have open house events, because we were finding that some people that were pill shopping or drug shopping would pose as house buyers and go into homes and ask to use the restroom and actually raid the medicine cabinets. So these are things that you didn't have to think of before, but you have to think of now, because whenever anyone has access to your home, whether it's the cable guy or the cleaning service, they have access to your drugs. So this is why it's so important to lock up your medications, count them, dispose of them if they're no longer needed in a proper environmentally friendly way. We're also talking to funeral homes. Actually, I go at Mercer County Community College, there is a specific program for funeral directors, and I go in and I speak to the students about talking with their families or clients. Again, when someone has been very ill from a long illness and passes away, many times there are many drugs left in the household. For a time, we also heard that people that at funerals, people with addiction problems were searching when are the funerals so that they could go and actually break into the homes and take some of these drugs. And again, it's a thought process you didn't have to think of at one time, but now we do. We also advocate for increased evidence-based drug education programs in schools. I'll talk a little bit about that in a second, but also the promotion of Narcan trainings. If you haven't been trained in Narcan administration, it's very important, and it's a simple training to go through, but it's something that could potentially save a life, and we are actually having one in October. There's some flyers outside, and you will be given a free Narcan kit as well. Promoting the Good Samaritan Law, again, the Prevention Act, educating parents on the risk of opiate use. But it's important as a prevention professional to understand that prevention exists on a continuum. And in the very beginning, we really have to start by primary prevention and educating young people on why they should be only putting healthy things in their mouths and not drugs and alcohol and so forth. So prevention has to start at a very young age, at preschool, and it has to continue throughout school. And it can't stop at 5th grade DARE or other programs. It has to be consistent throughout the school, one's school career. Because if we don't do a good job in the prevention stages, people then move on along the continuum into treatment and then into recovery, which is where this epidemic has taken us. And as Angelo had mentioned, we can't arrest our way out of this. We can't really treat our way out of this epidemic. But in fact, I do believe we can prevent our way out of this. We can start with prevention, again, at a very young age throughout the school career. We know that for every $1 spent on drug prevention, anywhere from $15 to $18 is saved in future societal costs. That's from the Substance Abuse and Mental Health Services Administration. When we do underage drinking prevention, it's also heroin and opiate prevention. When we do marijuana prevention, it's heroin and opiate prevention. Because delaying the first use of any drug for as long as possible, for at least the age of 19, if that's at all possible, a young person has a much better chance of not becoming addicted to any drug at all, because the human brain, as we know, is not fully developed until the mid-20s. And when you introduce substances into the developing brain, it can start to pre-wire that brain toward addiction. The factors that cause addiction, we know, are very complex. There are some factors we have no control over, like genetics or a predisposition to addictive behaviors. But we do have control over delivering prevention messages consistently in the schools, at home, in the workplace, and from all sectors of the community. And I really do believe it is our moral imperative to give youth the skills and tools that they need to keep them safe from drug addiction. So with that, that's all I have to say. Thank you again for being here.
Thank you, Barbara. And our final two panelists are going to talk a little bit about the treatment and recovery side of the crisis. And our first speaker is John Mincarelli, and John is a recovering addict who has over 8 years of consecutive clean time. He works for a nonprofit organization called Recovery Advocates of America, who help people suffering from the disease of addiction. And John's a certified peer recovery specialist, recovery coach, and a certified recovery coach trainer. He's given a lot of years to helping others and sharing hope of recovery, and we're glad he can share some time with us tonight.
Thank you.
Thank you, John.
Thank you. It's a pleasure to be here, and I was sitting over there listening and just so emotional, like, looking at the panel up here, and each and every person up here I know pretty well, and I know where their heart is, But I want to thank the mayor. I want to thank the East Windsor Police. Like, you guys are amazing, and you deserve a round of applause, because I just think you guys some great things, right? And so I am a recovering addict, right? I came into recovery in 1984. I didn't stay clean in 1984. My father, they talked about giving me a lobotomy. They talked about giving me electric shock therapy. My father said no to those things. They threw me in a tub of ice water. I woke up strapped to a bed, full of vomit and other things, and that's how I detoxed the very first time. We've come a long way in treatment, okay? I know Tammy, I'm a part of this ORP program, Opioid Overdose Recovery Prevention, right? Yeah, I got it. So when there's an overdose, right, and we just had one a couple weeks ago, the girl was Narcan 6 times. 6 times, right? That's how strong the heroin is and how it's laced with the fentanyl, and this Narcan isn't even working, right? And we talked about, getting people into treatment and the governor's new proposal, and that's great, but the bottom line is there beds, okay? If you have private insurance or you have an insurance policy, I can get you into treatment, no problem, right? No brainer. Make a phone call, detox, boom, you're in. But if you have a Medicaid, you have to wait, okay? As an addict, as I'm waiting, guess what I'm doing? I'm shooting dope. That's what I do, okay? This time, right, I'm that guy that had a lot of years clean and relapsed and wound up being homeless, living in Fairmount Park, Philadelphia, eating out of dumpsters. That's my story, okay? So I know both sides, and I'm grateful to be here, and I'm so thankful to be here. And we've come such a long way, but there's so much further to go, right? I was sitting back looking at all the people here, and this room should be packed. This room should be packed. Because if you don't think this affects you or it will affect you, when I used to rob people, I didn't rob in my neighborhood, I robbed in your neighborhood. I came after the victims, and the victims were the people that had no idea what was going on. This room should be packed out, and it breaks my heart that it's not. Because each person knows somebody. If you don't think it's going to affect you, you don't think it does affect you, it does. It affects us economically, it affects us socially, okay? There's no big wall between the hood anymore and East Windsor, okay? There never was a wall. When it was over there, maybe we didn't recognize it as much for whatever reason. But guess what? It's in our backyard, and here it is, okay? What happens is I get a phone call, from Jocelyn, who works for Mercer County in prevention, and we have a Narcan reversal at so-and-so hospital. Can you come and talk to that person? Hopefully they're willing to go to treatment. I get a chance to talk to them, tell them a little bit about the benefits. And the idea is to let them see that this is a benefit, right? This is a no-brainer. Are you tired of living life like that? Are you tired of eating out of the dumpster? Are you tired of shooting dope? Okay? Wondering what you're going to do tomorrow and how you're going to get that $4, $5. The economics, you can't buy the pill anymore. Angelo talked about that. When we're talking about $20 compared to $4 or $2, guess where you're going? Economically, you're going to that bag. And you swear, John, that you'll never shoot dope, but when you can't get that feeling anymore from sniffing dope, you have no choice but to shoot dope, okay? And it will take you to places and make you do things you never thought you would do, okay? Fortunately, we're making a lot of great strides. But Tammy talked about the 62,000, right? 62,000 that didn't make it this year. And this is what I deal with every day. Because that 62,000, okay, is important, but it's that one. That one, right, in that 62,000. So I had this young man, okay, his name is Cody. Cody overdosed 13 times. And they called me to the hospital, almost everyone, and I'd known Cody from back in the day, right? 22 years old Cody is. And so on number 13, well actually number 12, we tried to put Cody in treatment. He said, yeah, he would go. We got him a cab, driving him to treatment. He jumps out of the car. Number 13, they call us to the hospital. I said, Cody, what do you want me to do? He said, John, I'm not ready. He said, and if I'm not ready, I'm not going to do this. He said, it makes no sense. I said, so what do you want me to do for you? He says, he said, can you get me some food? So I talked to the social worker at the hospital. She said, yeah, I'll give him some food. I said, do you need to take a shower? Because I'll talk to the hospital. He said, John, I'm living in an abandoned house with running water. He said, I took a shower. So I started teasing him. I said, you know what, Cody, 13 is an unlucky number. He said, yeah, but I made it, So on August 23rd, just a couple weeks ago, this is the call I got from Capitol Health. I just want to play it for you.
Hi, John. It's Taz with sad news. Cody Wright is here. They believe he is brain dead. And, I went over the moment they brought him in. I believe his family is here. I have not seen him, but I just spoke to the nurse who was working on him. They've moved him upstairs. and they're going to look for some brain function, that he was down for quite some time. Sorry to share the news. Take care, dear. Bye-bye.
That's what I deal with every day. Every day. Cody is a person. Out of that 62,000, he's 62,001. Or maybe he's 59,999. I don't know. They're dying because we can't get them into treatment long enough. I was fortunate enough to live through my active addiction. A woman told me, she said, John, you might get lucky and die, or you may get unlucky and live through the horrors of active addiction. I lived through it, but a lot of them don't. We need more beds. I can put a person into treatment. I can't save anybody's life if I have nowhere to put them. That's all I have.
Thank you, John. And finally, our last speaker is Joel Morales. Joel is the founder and CEO of Mainstream Recovery. It's a training and consulting firm focused on developing recovery support services for communities and organizations. He's also a part-time advocacy field organizer with the National Council on Alcoholism and Drug Dependence in New Jersey. Joel is personally in long-term recovery himself and a recognized leader in the recovery field. A co-founder of the New Jersey chapter of Young People in Recovery, and a board member of the Middlesex County Local Advisory Committee on Alcoholism and Drug Abuse. Thank you for joining us, Joel. Appreciate it.
Glad to be here. First, I guess, thank you to everybody for being here, to the council for putting this on, something that is just absolutely, the opiate epidemic, prescription pain medication, heroin, fentanyl, synthetics, just completely out of control. Being on the front lines of this every day, dealing with a lot of stuff like you just heard on that voicemail, tearing families apart, tearing communities apart, just absolutely horrendous what is going on right now. So as much as we can do this, as much as we can learn about it, have our voices heard, and learn and share information with others is really what we need to do. So once again, my name is Joel Plamalis. I'm an advocacy field organizer with the National Council on Alcoholism and Drug Dependence here in New Jersey. Coordinate teams of volunteer advocates, trained advocates who focus on community issues, both on the legislative side and just raising awareness in the community to reduce stigma. I'm also the founder and CEO of Mainstream Recovery. You guys heard that already. Most importantly, I'm a person in long-term recovery from a substance use disorder. Substance use disorder being a clinical term for an addiction, a substance addiction, a drug addiction. I've been in recovery for a little bit over 6 years, since July of 2011. Being in recovery for me means abstaining from the use of alcohol and all other drugs while rebuilding my life, learning how to keep my illness in remission. I've been able to do that with long-term treatment and recovery supports in my community that I had access to. So, while my topic here is stigma, I'm going to mix in a little bit of my personal story. I dealt with a lot of stigma in my time. So I lived with an untreated, misdiagnosed, underdiagnosed illness for about 12 years, almost 13 years before I came into recovery. During that time, it brought a lot of pain and hardship, confusion to myself, to my community, to my family, and to my other loved ones. So it's important to know that addiction is defined as a primary chronic brain disease. It's identified as either an illness or a disease by every leading health organization in the World Health Organization, the National Institutes of Health, the Substance Abuse and Mental Health Services Administration, and the White House Office of National Drug Control Policy, which actually sets the laws surrounding drug policy in our country, either an illness or a disease, depending on which way you go. So it's not a moral failing. So after I was educated, I learned that I had an illness and not a moral failing. When I had access to treatment and recovery support, only then was I able to become a positive, productive member of society and of my community, in which I work, I pay taxes, I vote, I'm an avid volunteer in my community, I'm very involved in the community. I also got back to my family. Coming into recovery, I learned how to be a son to my mother, a brother to my siblings, a cousin, a grandson, an uncle to my niece and nephew, and a friend. My illness robbed those things from me for a long time. You know, long time I thought it was like me making bad choices or, you know, misunderstanding, whatever it was. I wasn't able to be those things even though I desperately wanted to be and tried. So for those who don't know, stigma is defined as a set of negative beliefs that a group or society holds about a topic or a group of people. The stigma surrounding this illness comes from a long-standing perception that people who use drugs are bad people. You see, a long time ago, we waged a war on drugs in our country, which really became a war on people who use drugs. We criminalized addiction rather than treating it as a public health issue, which it is. Addiction is the #1 public health issue facing our country. One of the stats mentioned before, in 2012, I think we surpassed car accidents as the #1 leading cause of accidental death in our country. Here in New Jersey, we're way ahead of the curve. It was 2009 for us. So, fun fact, not really that fun. So when we criminalized addiction, we placed draconian drug laws in place, which incarcerated people for very lengthy periods of time, sometimes life. And we also made a person who uses drugs a criminal in the eyes of our society and our culture. We have many decades of stigmatizing laws and views that are ingrained into our society, which creates many barriers for addressing this issue today. You know, it's not about, you know, policy or the, you know, the prosecutor, law enforcement being here. In fact, you know, Mr. Onofri, Mr. Benson are some of the most visible people that, you know, I've seen on this issue. So it's not, you know, this is long-standing stuff that I'm addressing. You know, understanding that we see how stigma is carried over throughout the years, right? The criminal justice system, 8 out of 10 individuals that were arrested had some type of substance use involvement when they were arrested. We have 65% of all inmates meet the medical criteria for a substance use disorder in our country. 11% of those individuals receive treatment for their illness. When we talk about recidivism rates, when somebody's incarcerated and they're released, them going back to prison or being reincarcerated, we have about 76.7% of individuals being rearrested. About 56.7% of those individuals are rearrested within their first year. So when you think about the percentage of the prison population that has a substance use disorder and the recidivism rates, how treating addiction or treating this as a criminal justice issue, not, you know, what happens to the individual, but to the community as a whole. When we think about how much it costs to incarcerate somebody, how much wasted taxpayer spending goes into wasted man hours on the law enforcement side, addressing this in the community, along with all the other stuff, from a stigma, from a certain perception that we have, you know, on an illness. We need to speak out, share our experiences to educate others to continue to eliminate stigma. Everybody here, you know, I appreciate you being here. I'm not remiss to push people a little bit more, to do more, to be involved more, to get involved with, you know, Recovery Advocates, City of Angels, the Coalition. Every township has a municipal alliance. There are a ton of organizations and ways to be involved and volunteer your time and impact this, whether it's getting to know Mr. Benson and having your voice heard by your local legislator or elected official. Just please be as involved as you can. It's so important. Together, you know, we can really have an impact on this. So thanks everybody for being here. Thanks for listening.
I want to just quickly, I didn't do this at the beginning because I wanted to get my comments. I mentioned Councilmember John Zoller before. Also want to recognize Councilmember Alan Rosenberg and Deputy Mayor Perry Shapiro, all part of our East Windsor governing body and involved in many of these initiatives, and I'd like to just recognize and thank them. So on behalf of East Windsor Township, I want to thank all of our panelists for coming out and for sharing your comments, your experiences from your own lives, your own interactions, and your thoughts about how we can work together to do a better job at addressing what obviously is a extraordinarily deep and serious problem in all of our communities. I want to thank everyone here. I think that there's probably not a single person here that didn't learn a good deal tonight, even those who are involved in this area and have been advocates. So I think it's been a tremendously valuable evening. And as was indicated at the beginning and at the end, it's obviously important that everybody remain involved, everybody remain advocates, share the information from tonight, and help promote the opportunities here for people and individuals and families to receive assistance and support and struggling with these very, very difficult and life-destructive situations. So I want to thank every one of you because you're here because you care, and you're going to be messengers after tonight here in East Windsor Township to help us in our community address this and really make a dent and a difference in the lives of people here. So thank you, thank you, thank you. Thank you. Please pick up the flyer. Please pick up the flyer on the way out. That's on the table right here.
Thanks, Councilman. Pleasure to meet you.